At this point, Dr. Seidman is completely awake.
As you can see here, I'm wide awake. I'm looking at the screen, watching my surgery being done.
Is this my knee or somebody else's knee you're operating on?
They're knocking. I'm like, come on in.
Come on in.
Hey, I'm Dr. Michael Seidman. Great to see you today. I've got an amazing video I'm really excited to share with you. It's about this dude, if you can believe it, who blew his ACL and elected to have it reconstructed, not using general anesthesia or spinal, but rather acupuncture and guided meditation. Check this out.
I'm optimistic that I won't require much, if any, anesthesia.
Are you seeing what I'm seeing? Yeah, kind of looks like me, right? It is me.
The acupuncturist, Ramon Nunez, connects a small stimulating device to the acupuncture needles, increasing the numbing effect. At the same time, Dr. Levine, himself a hypnotherapist, will help mentally prepare Dr. Seidman for surgery.
The power of the body and the mind is what we need to harness and what we need to do in medicine today. And I think this video really captures that. And yes, I'm the crazy guy. That's really me.
An anesthesiologist will give pain medication as needed to ensure his comfort and safety.
I told him I'd be willing to work with him and ensure that he was comfortable and that his body wouldn't take on any undue stress. And I would intervene with a general anesthetic if necessary.
I had to have a heart-to-heart with her beforehand. I said, you're not putting me to sleep. I'm going to get this done. She goes, I am putting you to sleep if your body is going under any undue stress. And we managed to get through it. She's amazing to work with. And then that really good-looking leg is mine.
And the surgical team ready, this incredible operation will begin. The 2-hour surgery will now be in the hands of his surgeons, Dr. Kyle Anderson.
Close your eyes, you're about to make a cut. Don't let it freak you out.
Starting.
0 to 10, Michael. He likes some feedback.
About a 3 or a 4. It's pretty sharp, but not bad.
So they're cutting my knee open with a blade. You can see that. And I don't want to say I didn't feel a thing, but it wasn't bad. And typically throughout the procedure, they'd ask me on a 0, no pain, 10, I'd have pain. I averaged probably a 2 or a 3.
I don't feel like he's doing anything to me.
Very good. Things are happening, so that's very good.
And this is critical because orthopedic surgeons, even today, basically anything they operate on, they put a tourniquet on for the most part. And I said, you can't use a tourniquet. And they go, we have to use a tourniquet. And I said, no, you really don't. What if I can make it so I don't bleed into that site? And they go, well, that's impossible. And is it? About 20 minutes into the surgery, and this is the most important part, 20 minutes into the surgery, I said, hey, is there any bleeding? And they said, there ain't much bleeding. And I said, would you like me to make it less? And they kind of laughed. They said, no, whatever you're doing, just keep doing it.
At this point, Dr. Seidman is completely awake.
Is this my knee or somebody else's knee you're operating on?
We're just showing you this is a trick. We're just showing you someone else's video.
So as you can see here, I'm wide awake. I'm looking at the screen, watching my surgery being done. And I said, hey, is this my knee or somebody else's knee? So I was having fun with the surgeons. And there were a couple times when I got up to a 6 or a 7, like when they were drilling holes in my femur and my tibia.
Pretty awesome. Come on in.
As the surgeons reach the inner bone, the pain intensifies.
Feeling some discomfort.
Let's see my number.
About a 7. Occasionally, right knee.
Okay, you coming down?
Right knee, right knee. Yes, it is. Ow.
And they would up the acupuncture, the electrical stimulation, and the mindfulness person, Dr. Levine, Bob Levine, would kind of walk me through it. In 30 seconds, they started again. It's pretty amazing. Check this out.
The team questions if Dr. Seidman will be able to go on.
Relax.
You do feel this?
No, peaceful, confident, relaxed. It's just what the bend of my knee is what's most uncomfortable, frankly.
So this is where it got a little bit dicey, perhaps, and they were kind of seeing if I could go on. But really, what hurt the most was the bend of the knee. They have your knee rotated way out, and they had me contorted, and I'm not very limber.
But with Dr. Levine and Ramon at his side, Dr. Seidman is determined to continue.
And you can have those feelings. That's not a problem. It does not affect who you be, right? There you go.
And when you accommodate, you're accommodating to just feeling the stimulus, not to the anesthetic effect. We got through the worst of it, Mike. Now we're closing. Your game.
So I was just obviously thrilled that I got through this. That's kind of why I was happy. They said I got through the worst part of it.
With surgery complete, Dr. Seidman is overwhelmed by his remarkable accomplishment. Dr. Anderson shares in his achievement.
Well, I was very skeptical that we would be able to get through this without providing him essentially general anesthesia. Now, having gotten through it, I'm really impressed with him. I think that a lot of this was his desire to be able to get through this.
I had a little bit more hair,
ability
too.
to put pain out of his mind.
You know, that was Kyle Anderson, one of the team doctors for the Detroit Lions and the Red Wings. Super great guy. And, you know, he's a typical MD like I am. I'm a medical doctor trained at University of Michigan. You know, we're skeptical about everything, as you and I should be. And I want to critically review the science and things of that nature. And he said he was impressed with me. And it's just, yes, I wanted to do this. I think anybody can do this if they really want to do this.
You know what, I thought we would make it through the knife hitting the skin. I thought we would make it through the first 10 minutes or so. I did not believe we would make it through the entire procedure of harvesting the graft and drilling the bone and putting in bone screws and so forth.
You know, as a scientist and a physician, I've read about this. I know that it works. And part of me was chicken to do this because I thought I'd have pain, but I knew I had a backup plan. And I'm just thrilled to death that I didn't have to use it.
And less than 2 weeks later, he's back at work, recovering even faster than expected.
Well, I was back to work 8 days after surgery. So, yeah, they usually say that people take anywhere between 2 and 6 weeks off, depending upon what they do. 2 weeks for a desk job, and I don't have a desk job. I move around a lot. So they thought I might be pushing it a little bit, but I've actually done quite well.
So I think that's also interesting. They told me pretty much 6 to 8 weeks away from work, and I was gone for, I think, 7 or 8 days total, and I was back at work. The other thing that's really critical to me is that they said most people are at about 90% strength at about a year, 95% strength at a year. I was at 90 to 95% strength at 2 to 2.5 months. So it's pretty amazing. And I think a lot of that is that I didn't allow them to use a tourniquet, that we had the power of the mind to help keep the blood away so they could do what they wanted to do. And it's just amazing to me that it worked.
Interesting, when I talked to most people and I said what I had done, they look at me as though I was absolutely crazy. And they say, you know what, just knocked me out. And so this is not something for everybody. It takes, you know, the right hypnotherapist and acupuncturist and the right patient, I think, to make it work. And it worked well for me, so I'm just pleased.
Yeah, you might call me a little crazy, and perhaps I am, but I do believe in the strength and the power of the mind and the spirit, and I think that it can help you too.